Aloha guys, Dr. Thomas back, just like I promised. Continuing with the heart. Oh no, I forgot the PowerPoint. Here it is. Can we see it now? Okay, all right. All right, cardiac conduction system. Again, myocardial muscle, heart muscle, beats all by itself. But it has to have a nerve signal, electrical type signal, in order to regulate it. And that's what this cardiac conduction system is all about. Here's the parts to it. The pacemaker itself is called the SA node. Then the nerves run from it down to the AV node. This is in the right atrium. The AV node is kind of between them, but we'll see in the drawing. Then it goes through the bundle of His, and then the bundle branches, which they don't have in this list and should be, and then the Purkinje fibers. As this electrical signal is conducted down through there, guys, it causes a contraction of the muscles in that same order. When a person gets an EKG, ECG, same thing, electrocardiogram, this is what it's mapping out. And the doctor can determine by the patterns it makes if things are normal and or if there are pathologies or problems present. Okay? We can make more sense of it here. Cento atrial node or pacemaker, everybody just calls it the SA node. Everybody calls it the SA node. It's up here in the right atrium. It's what causes the beat. It's our natural pacemaker. Then the nerve impulses go down to the AV node. And it's actually right at the border between the right atrium and the right ventricle. Then the signal continues to be conducted. It goes to the bundle of His. Then it branches into right and left bundle branches. Goes the rest of the way down through the ventricles. And then it recurves up into the right and left ventricles. And these are called the Purkinje fibers. Now, I'm assuming that a Dr. Purkinje is who first mapped or discovered all that stuff. And it's why you have these kind of odd names, or Dr. His. That, guys, you have to know those. You have to know them all. But how much are they? SA node, AV node, bundle of His, right and left bundle branches, right and left Purkinje fibers. There you go. See, it's easy. Okay, the SA node originates the cardiac impulse. That's why it's the pacemaker. The cardiac impulse spreads to the AV node in the left atrium. Looks like it's between them, but okay. And that causes the atria to contract. The AV node slows the cardiac impulse and sends it to the bundle of His. The bundle of His sends the cardiac impulse to the Purkinje fibers, which are located throughout the ventricles, and that in turn causes the ventricles to contract. When the atria contract, it squirts the blood down into the ventricles. The valves shut. When the ventricles contract, whoosh, the right one is sending it to the heart, to the lungs, as you were to the lungs. The left one is sending it where? Whoosh. Where? No one ever answers me. Yeah, it's sending it to the systemic circulation. Automaticity and rhythmicity. Automaticity, cardiac pacemaker cells generate electrical signal without assistance. What's that mean? They just do it. The SA node is the natural pacemaker of the heart. Dysrhythmic, when heart rhythm is disturbed. There's a lot of different conditions that have arrhythmias and various alterations in normal rhythmic patterns. Now, as you know, you probably know people that have a pacemaker put in. Well, in the event of heart disease or heart problems, when the SA node is not doing what it's supposed to do, they can implant a device that takes over for it. And that's, an artificial pacemaker. Okay, electrocardiogram, EKG, ECG. Probably in modern times, it's more commonly known as ECG, but EKG is the older name. That's the one I like. So, as that pattern, as that nerve signal, I don't want to call it electricity because it's not really electricity, but it has an electrical quality about it. As it runs down from the SA node to the AV node to the bundle of His to the bundle branches to the Purkinje fibers, that is what's mapped out. And this is an example, guys, of a quote normal EKG through one heartbeat. It's called the PQRST. PQRST. At least it's in order. The P wave is the impulse when the atria depolarize. So the atria depolarizing and beating, and subsequently beating is what makes the P wave. The QRS complex, which is this big one, Q up to R and down to S, is when the ventricles depolarize. Now, the ventricles are a lot bigger, guys. They're a lot muscular. They have a stronger signal, so they make a bigger wave on the paper. So this is the atrial contracting, or the depolarization of the nerve. This is the ventricles, and then the T wave is ventricular repolarization. Now, I know what you're thinking. You're saying, Dr. Tom, if there's a ventricular repolarization, where's the atrial repolarization? Yeah, very smart. Yeah, I like that. Well, it's in there, but it's small. It's a runt, so it can't be picked up. It's hidden somewhere in all this other noise. So the way that these things vary, guys, if in fact they do, and the timing of it and all. See, these are times in seconds, 0.2 seconds, 0.4, 0.6 seconds, 0.8 seconds. So this is almost a second here. And then these are millimeters. The timing and all of it also give the doctor diagnostic information. This is important to know. PQRST wave is what this is called. The P wave is the atria depolarizing. The QRS complex is actually what it's called. QRS complex, not wave, is the ventricles depolarizing, and the T wave is the ventricles repolarizing. So in other words, guys, this is the electrical representation of a normal heartbeat. When the atria depolarize, they pump. When the ventricles depolarize, they contract and pump. Make sense? Now, on an EKG, you'll have a paper with a readout of this, with a bunch of these, not just this single one. All right, I'm going to tell you something about EKGs. In my opinion, EKGs are done around the world all the time. They're an important diagnostic method done in doctors' offices. Those of you who are in the MA program will be doing. You'll have a class and you'll learn how to do it. You got to hook up all these electrodes in different ways and then punch the button. Here's what I think about it. I think it's important, but like so many diagnostic tests, I think they put too much emphasis on it. Why do I say that? Because I have known patients who had normal EKGs that still had problems in their heart. Now, I've never worked in this field. This is outside of my field. But I've met people who have, and they say the same thing. They've actually told me, they said, I tell you, Doc, I don't trust EKGs. They're one piece of information, one piece of the pie. But you shouldn't base important diagnostic decisions and all on just the findings of an EKG, in my opinion. Now, I'm sure there are plenty of doctors who will argue and say, Dr. Tom, you're a damn chiropractor. What the hell do you know about an EKG? Well, I know quite a bit because I studied it also. We still had to do it. Okay, I'm sorry, I'm getting a little carried. I'm actually just acting all this out. In my opinion, there is an overutilization of diagnostic tests in modern medicine. They depend too much on them. But and I think that this fits into this category. However, it's still very important, and it still needs to be utilized, and it will be. Okay. Let's go back and go over the chambers and stuff again. So what am I saying? Well, just don't rely completely on an EKG. It's one piece of the puzzle. All right, let me tell you a story. Many years ago, I was treating a guy. He was in his latter 30s. It's a little bit heavy. For a back problem. He said, you know, Doc, he said, I've got a little boy at home. He's like 6. And I start chasing him around the yard. He said, I start having real bad chest pains and the pain running down my arm, my left arm and all. And I said, what happens when you rest? He said, oh, once I sit down and rest, it goes away. Now, guys, that's the classic textbook description of angina pectoris, or angina pectoris. The absolute textbook description. He has blockages in his coronary arteries, and when the demand increases during exertion, his body can't make it, and that's why he's having that chest pain and all. And also the other part of it is it goes away quickly with rest. I said, man, you need to see your doctor. Well, I've already seen them, Doc, and they said everything's okay. They did an EKG, it was normal. This is where a lot of this comes from. So he came in several times for treatment. I kept telling him, I said, Bob, you need to go see a cardiologist. So finally he did. In fact, he did have partial occlusions. He did have a heart problem, and they put him on treatment. He had exactly what I said he had. But here the doctor is listening to this absolute textbook description of angina, which indicates it's cardiac ischemia, and he's freaking ignoring it and going by the EKG, which is, for whatever reason, is normal. You see where I'm coming from, guys? Okay. I never forgot that. Heart, remember the heart has a sac around it called the pericardium. It's a double pump. Right side pumps the lungs, left side pumps the systemic circulation. There are 4 chambers in the heart, 2 atria and 2 ventricles. Atria are little on top, ventricles are bigger on the bottom. There's a right atrium, right ventricle, left ventricle. There are also these great vessels right here. Here's the aortic arch. Here's the pulmonary trunk. The left pulmonary artery going to the left lung, the right pulmonary artery going to the right lung. Why are they blue in their arteries? Because they're the only exception in the body, they're carrying deoxygenated blood. Coming back, here are the left pulmonary veins and the right pulmonary veins. Same thing. Why are they represented in red? Because they're carrying oxygenated blood, fresh coming from the lungs. Blood coming from the body enters the right atrium from the superior and inferior vena cava, these gigantic veins. When the atria contract, it pumps the blood down through the tricuspid valve, into the right atrium. When the right atrium contracts, it pumps it up and out to the pulmonary arteries and sends it to the lungs. When it comes back to the lungs via the left and right pulmonary veins, it goes into the left atrium. The left atrium contracts, it goes through the mitral valve down into the left ventricle. When the left ventricle contracts, it goes out the aortic arch, and all the big arteries branch off of that. Atria contract, boom. Ventricles contract, boom. There's 4 valves in the heart. There's a bicuspid valve and a mitral valve here, a pulmonary valve, and an aortic valve here. The sound of those valves slapping shut, slap, slap, is what makes lub-dub, lub-dub, the sound of the heart beating. Atrioventricular is bicuspid, tricuspid on the right, bicuspid or mitral. Remember I said mitrals, for my experience, is the more common term. Very important. If they don't seat, if they don't seal, if they don't perform right, oftentimes they have to go in and put it in an artificial valve. They used to take them out of pigs' hearts. I don't know if they still do or not. Why, pigs are very similar anatomically and physiologically to humans. Pulmonary goes to the pulmonary trunk, aortic seals off. And again, these things, by closing at the proper time, they direct the flow of blood. You got to know all 4 of them? Oh, yeah, man. Yeah. Lub-dub, lub-dub. Murmurs are turbulent blood flow that's getting around or leaking through. Some are quite serious, some don't have any significance. We've pretty much gone over all this a couple times now. Again, left atrium is sealed off by the mitral valve from the left ventricle, and in the left ventricle, the aortic valve and the aorta. Aorta is the big artery of the body. There are a number of shunts and problems and all, guys, but there's no sense in going into this. It's one aspect of several different ones. These coronary arteries are very important. Why? Well, heart attacks are the leading cause of death, and strokes, which are collectively called cardiovascular disease. These coronary arteries are what feed that all vital, important cardiac myocardial muscle. And then there are also veins. What do they branch off of? The aorta, the ascending aorta. It's in the back and you can't see it in this drawing. The heart is actually hard to draw. If they get plugged up, you start having heart problems. Here's angina, the one my friend I was talking about, or angina. It's angina pectoris is the full name. MI, myocardial infarction. We're about to run out of time. These enzymes, they look for them to indicate possible heart problems. Okay, we'll come back with the physiology of the heart. Dr. Thomas signing off again.